Oh,
There we
okay.
go.
Oh, there we go.
Okay, there we
I don't
go.
know what happened. I have never had that happen before. That was
That's
that
all
was
right.
weird.
We figured it out.
That's great. Well, it's nice to meet you.
It's
Yes, thank
nice
you
to.
for your time.
I'm Camden. I'm the founder of Clarity Reach. This is my sister.
I'm Donya, co-founder.
Nice to meet you both. Nice to meet you. Well, thanks for reaching out to me. It sounds like you guys have done a lot of great work and are passionate about the issue of myopia control and working hard and advocating. So that's fantastic. And sounds like you've interviewed a lot of people and met a lot of people.
Yes, we're very fortunate. Everyone's very supportive and helping us out.
That's great. That's great. Well, it takes a village to get these types of things done. And it's wonderful to have patients and non-healthcare professionals also, talking about the message because, this is something that affected you guys personally, and you have the ability to speak about it from a personal level. So that's great.
Yes, thank
Yeah.
you so much. Do you want to start?
Yeah, so I can just really quick introduce what Clarity Reach is and my personal connection to it.
Sure.
So, Clarity Reach is an organization I founded at the start of my junior year due to my experience with myopia, which I was diagnosed at age 3. As every year I would go to the eye doctor and I would receive a new prescription. I never understood what that meant, what myopia was. I just assumed it meant, oh, I need to get thicker glasses every year. But as I got older, uh, I got access to new information. And although a lot of the information online was unclear for me, I still did the research and found out what myopia was and how it's not just needing glasses, but there's various other consequences like retinal detachment, glaucoma. So with all that information, I founded Clarity Reach, which is a organization where I want to give everyone a platform where they can access information very easily while also knowing everything they need to know about the risk factors regarding myopia so that they can hopefully slow the progression down rather than just give their child new glasses every other year.
Yeah, that's great. It's important to know what's going on, and it really hasn't been until recently that we've had more research and dedication to knowing how to slow that down.
Yeah.
So you're really kind of at the cusp of all this myopia management and what's happening in the last 5 years.
Yeah, if you don't mind introducing yourself and how your journey through clinical practice, education, and organization optometry led you to become the CEO and executive director of the Ohio Optometry Association.
Absolutely. Thank you so much for asking. Yes. So when I was young and in sixth grade, I too developed myopia and didn't really know it. And I think that's the biggest thing that hopefully we can talk about today is that, most kids don't realize when something's not normal. Things happen so gradually that you think it's normal. And I was sitting in classroom one day and everybody was copying and working hard. And I'm just looking around like, what's going on? And I had no idea there was anything on the chalkboard to copy. And I was in sixth grade, so I wasn't a little kid, but I was old enough to know that maybe I should be seeing something. And so I kind of walked up to the board and saw what was up there. And I told my mom, and I said, I think something's going on. And she came into the classroom and she's like, you can't see that? And I'm like, no. And took me to the eye doctor and got my first pair of glasses. And so that kind of spurred my interest in optometry. My brother also had a lazy eye or an eye turn as a child, and kind of around the same time. So, talked a lot about eyes and vision and getting your eyes checked. And getting my first pair of contact lenses was just a game changer for me back in the day when they started to develop disposable contact lenses. So that's kind of what got me in. I always thought I was going to either be a teacher, professor, or go into healthcare. But optometry spoke to me because of the fact that it's just life changing to be able to see and to help somebody see. From there, I knew that this was my journey and I wanted to be an optometrist. So I knew that in Ohio, the Ohio State University College of Optometry is the only college in Ohio for optometry. So I chose to go there for my undergraduate degree and then hoped to get in for optometry school, which I did. And was able then to have a career there as a student and get a lot of opportunities in ocular disease, which led me to doing a residency in ocular disease after, my postgraduate education. Worked a lot in a multidisciplinary clinic with ophthalmology and optometry side by side, and worked through advocacy and understanding that optometrists are qualified and trained to handle medical conditions and all the primary care. So that led me to being involved in the Ohio Optometric Association Board of Directors, where I ran and served on the board of directors for 9 years and loved it. Was worked a lot with ophthalmology, 27 years in career in glaucoma management. Wrote a chapter in a textbook for glaucoma management, and decided that it was time to do something different. The current executive director of the Ohio Optometric Association had moved on, and the timing was right. And I was fortunate enough to be appointed to this position. And that's how I got here. I never thought I would do this role and leave clinical practice to do that. I had to retire from patient care to take on this role, but it was time. I saw 40 patients a day for 27 years and have a lot of experience and love advocating for my patients and optometry and want to really help patients. And that's what our association is all about, supporting the doctors that help provide this treatment.
Yeah, no, that's amazing. I really appreciate you guys having, I guess, sort of a similar motive to what we have, which is just trying to support doctors as much as we can. I think that's really important. Um, and you did touch upon it. So, from your perspective, why is public awareness of children's eye health still so important today?
Yes. So there's still not enough, you know, I'll say this, new parents, the first person they talk to is always a pediatrician. My child gets connected with a pediatrician, and they don't realize that there's more to just the well care than seeing a pediatrician. And pediatricians, they do vision screenings, but they don't always recommend, this is part of your well care. You get a once a year eye exam, you go to the dentist, but you don't have teeth until you're, 4 years old, then when you go to the dentist. But with eye care, we start seeing babies as early as 6 months. We recommend that examination take place between 6 and 12 months of age. And then, starting about age 2 or 3, if no problems are found every year after that, because your eyes grow and things change and kids don't communicate and they don't know when something is wrong. You just think something's normal. It happens so gradually that you don't realize you've got a vision problem because you've adapted, you've worked around it, and you don't know how something is supposed to look. So I think it's important to advocate for public awareness because parents don't realize that things can change like this, and they're counting on their pediatrician to do everything. But that's just a screening. It's not a comprehensive eye exam. And there are things that are missed on screenings that we obviously see on comprehensive examination.
Um, like you said, a lot of the screenings don't tend to catch everything. We did a survey, and through our survey, we noticed that a lot of people do not follow up on their care after failing a vision screening. So my question for you is, what roles should schools, pediatricians, parents, or even eye professionals play to make sure children do get these appropriate follow-ups?
Yes, that's where a lot of the gaps occur. The school systems are, doing the school nurses are doing the screenings. They send the note home that the child failed the school screening, and then nothing happens, right? So the gaps are there. Now here in Ohio, we're working to, close those gaps. And, we have a foundation that was founded by optometrists in the Ohio Optometric Association. And we have equipment, mobile equipment where we take it into the schools and we connect the school and schedule the school with a doctor of optometry local to the community. And that doctor of optometry will do the exams of the kids who failed their school screenings in the school right there. And we close the gaps. We don't bill for insurance. We just do it through donors and fundraising and non-for-profit work, as well as grants. And we have partnerships. So, those are important to build. But, I think there's a lot of barriers to why these kids don't get the follow-up care, even if they have insurance.
Mm. Yeah, in that survey that you mentioned earlier, we really observed that, and I just think those barriers are really interesting to note. Um, we also discussed those barriers with the U.S. House of Representatives for the 40th Congressional District. We want to kind of bring that up to them: awareness, access to care, follow through. So you have been involved in advancing the optometric policies in Ohio. What have you learned about turning a health issue into something policymakers are willing to act on? Because I know we struggled with
Yeah.
making them interested in the topic.
Yeah. So I think that you have to have personal stories, and their constituents have to have personal stories, and they have to make it their passion too. We have a governor who is, very dedicated to children's issues, so that's helpful. We have legislators who have had personal stories of, their kids failing a school screening and then not realizing that their kid needed an eye exam. And it's advocacy. It's talking about, if you can't see, you can't learn as easily, right? And then that sets you back your whole career in academics. And you have to work twice as hard, and it can affect your social outlook and your confidence, and sometimes even your behavior in class. It's multifactorial, and it's educating legislators on these things, on what is the long-term outcome of someone not being able to see correctly their whole time that they're in school. And how does that set them up as an adult and being a citizen in, the country or the state? So you have to tell that story, and then you have to provide good data. You have to have the evidence-based data, and you have to have your state data. The Ohio Department of Health has been a longtime partner of ours with educating children on the importance of a comprehensive eye exam. We've had our Save Our Sight grant in partnership with the Ohio Department of Health for over 20 years. We go into schools and present programs for kids at all school ages. We have 6 curriculums to educate them on why it's important that they take care of their eyes and get their eyes examined. So, starting even with your local Department of Health is helpful, or your state Department of Health, and then having them help also carry that message and getting the stats. We found in Ohio that 80% of the kids who were screened at school did not follow up for their comprehensive eye exam. And that's a powerful message to legislators when they see that.
Thank you for that advice. It's a long journey to communicate with legislators to make us be heard, especially since, we're student-led, we're like still
They'll
young.
actually talk to you guys more than they'll talk to us. They love students.
Hopefully, we'll see. We'll definitely bring up the data next time. We did mention our own survey, but again, we're limited. We only surveyed 400 people globally and 200 currently in California. So we're still in the
The
beginning of
early
our
stage.
research.
Yeah, and that's good. And, we have resources. The American Optometric Association has resources for you, and the American Academy of Optometry. And you can check out our foundation's website at icohio.org. There's a lot of great information there on what we do in our foundation through the Ohio Optometric Association.
Yeah, earlier I guess you mentioned that like talking to parents, talking to children, sort of like I guess helping them understand childhood myopia or just sort of that type of thing in general. Um, how can professional organizations help improve public understanding?
Yeah, that is a role. One of the roles of professional associations is to help educate the public and bring public awareness to the conditions that our doctors treat and manage. A lot of eye problems are silent. And silent thieves. You're not in pain, so it's important to educate parents on the importance of when it's appropriate to start having their child have an eye exam. Many think you have to be able to answer the question, which is better, one or two, to get an accurate glasses prescription. And no, we can get a very accurate glasses prescription on those that are verbally challenged or developmentally delayed or infants and patients that are elderly with dementia. So you don't have to be able to answer those questions. So it is educating them and making them understand, when it's time to start having those important checks.
You are a member of the AOA Research Committee, and how do you see a relationship between research and public education? Like, what is the connection between the two?
Yes, that's a great question. And I think more than ever, research is very important because you can see that evidence-based medicine is critical to get buy-in of people. And if you don't present information correctly and you don't do things in a scientific manner, misinformation starts to be dispersed, and then there's mistrust in medicine or mistrust in the healthcare system. So evidence-based medicine is critical without bias, and it's very important. And we've seen that over the last 5 years, post with the pandemic. What happens when we're not getting that evidence-based, and we don't have time to get the evidence, right? So I think it's important that we have that. And I know the researchers at Ohio State University College of Optometry were one of the first researchers in myopia research. Dr. Moody, Dr. Walleen, Dr. Zadnik, wonderful clinicians and researchers. And optometry is where the myopia research is. It's not in, medicine, so to speak. Optometrists are the one doing the research in myopia.
That's really interesting to consider that there's so many fields of research that some may not think of. Like we did mention, we did run a survey, it's called Project Lens, that examines parent awareness, knowledge, and perceptions regarding childhood myopia. So what findings do you think would be most useful for professional associations and public health leaders? What should we focus on?
That's a great question. I think what is helpful to us is to know what the public perception is of, when should they get their child an eye exam? Do they think that because they don't wear glasses, their child won't need to wear glasses? What's their perception of having a screening? Do they think that's a comprehensive exam? And I think many parents do. Many parents think that at the pediatrician's office or at the school, when they just read the eye chart from the distance, that's it. They pass that, we don't have eye problems. And that's not true. So I think getting an understanding of what the parents and public know about eye problems and eye care is helpful for eye care providers to be able to communicate the proper protocols and decrease misinformation.
Yeah, we found that around 73% of the people who we surveyed did not even know what myopia management was, which is a big target that we want to address, really bring advocacy and awareness so they understand that in order to slow myopia, it's more than just the glasses you wear on your head.
Yes. And now we have tools to do that. And it's really been within the last 5 years. So this is new. So when anything new comes out, people aren't aware of it.
Yes.
And that's the thing. And we've got some, different types of lenses, the Stellus lens that's out there. Cooper Vision has the Myopia Collective that they partnered with the American Optometric Association on in working to provide that information and get it out there to the public with their contact lenses, the MySight lenses. There's a lot of options to slow myopia down. Now we know it's eyeball growth. Dr. Moody at the College of Optometry did research and found that being outdoors is really important to slow that growth down, whether that's UV light, whether it's just not focusing so far up close all the time and being able to look far away to relax those muscles. There's still a lot of research on that, but it's important to bring attention to something new out there because people just haven't heard of it or didn't realize there were these options.
Yeah, I guess when I first saw the new research being done, the new preventative measures, I kind of sat down and I'm like, okay, this is really interesting. I want to think about something to do, hopefully to, like you said, get it out there because I thought it was very important. So that's what I personally did. But what advice would you give other students who want to create a lasting change in healthcare, say before they go to college, so around my age, like high school, maybe even middle school?
Yeah, I think what you guys are doing is great. And, it's best when a patient talks about their journey and other people can relate to it. So I think if there are other students out there that have different healthcare issues that they're passionate about or they want to help educate the public on, sharing their story is important. We now have social media, so things are easy to post and easy to talk about. It's not easy to get funding. It's not easy to get, financial backup for some of this, but certainly you can try and look at different grants and different avenues and work with different partners and professionals. Like you've reached out to us and reached out to the American Optometric Association and trying to learn more and meet the people that are actually delivering the care. So you have to, as a patient and you're passionate about something, you want to broadcast it. So you want people to know about it, and you guys are the ones that understand all the social media and how to reach people.
Yeah, that is definitely something we are working on, really that peer-to-peer connection, really bridging that gap. I know for a lot of people, speaking directly to providers can be scary. And we're trying to take the knowledge of providers and break that down accurately so they can understand. So that's one of our
I think
main
that's great.
goals.
I think
So
that's great.
looking ahead, what changes would you like to see in children's vision care and how it's delivered and accessed across the country?
I think that's a great question. So I have a lot of dreams for children's vision and for things. So I think every child has the right to deserve to be able to see. That's just a given right. And we need to break down those barriers and access, and we need to figure out the insurance system. Right now, refractive diagnoses like myopia or hyperopia or astigmatism are not treated as diseases. It's not until you get high amounts of myopia where you get myopic degeneration or glaucoma that it's called a disease. So insurances, regular health insurances won't cover eye examinations unless there's a disease process. So a lot of the routine eye care has to go to vision insurance, which not everybody can afford to take or have. And, that's problematic. So I think refractive diagnoses should be a disease. And I think we need to have pediatricians work harder to educate parents that they need to see an optometrist, every year. That's even if they pass a screening, they should be seen because there's binocular vision disorders and eye teaming problems that cause focusing challenges. And with all the digital devices and computers and things that we're using, we're seeing a lot more myopia and eye teaming and focusing problems. And parents trust the pediatricians. A lot of times they refer to ophthalmologists. Ophthalmologists aren't doing this type of work. They're there to see the surgeries and the lazy eyes and help straighten eyes and do the advanced procedures. I mean, they're highly skilled, but they're stretched. They got to be there for the corneal transplants and for the kids that have, the muscle problems or, bad congenital diseases that need, significant medical therapy. So leverage optometry, leverage the profession. We're the primary eye care providers, and we're here to see, these examinations and help these kids get the care they need.
Yeah. I know you mentioned the cost of eye care, and I know, like, even right now with Camden's myopia, getting atropine here in California is a
Yeah.
task. It is expensive, and currently it is off-label for myopia. So the shipping to get it to California to take action for his eyes is already a challenge. So getting that access, I'm hoping that one day, everyone will be able to get the access to the care they deserve.
Absolutely. And I think that's crazy because atropine is cheap. It's an old drug. It's been around for a long time. And I don't know if you guys have a program in California. In Ohio, we have something called GoodRx, where if insurance does not cover a drug or you don't have insurance, it's a program that you can go on and type your drug in, and there's coupons that you can use and pay cash for, and lowers the cost tremendously for those that are, even if you have insurance, you can still elect to use GoodRx if it's cheaper than your own insurance, because a lot of people have high deductible plans.
Right.
Um, and so even normal medicine on a high deductible plan is expensive because you have to pay full price until you reach your deductible. Um, so I think that's crazy that the atropine is that expensive and it's hard for you to get.
Yeah, we have to send it to a compounding
Compounding
pharmacy.
pharmacy. Yep.
So it's kind of like you got to jump through hoops. And when we interviewed some doctors in China, it was really interesting hearing that atropine and eye care is also expensive over there. So I think like even globally, you got to take a step for eye care, really, get the message out there, prioritize the need to see.
Yeah. And losing your vision is the second biggest fear on healthcare next to cancer. People, are fear cancer followed by losing their vision.
Yeah,
It's a big deal. It's a
it
big
is.
deal. And let's think about this. If you are highly nearsighted, and it's nighttime and there's a fire, how do you get out without your glasses? And you're a nursing home and you're bedbound and you can't see. This is function. This is function. So this is so important, and I'm excited that we now have research on myopia control to be able to reduce these high prescriptions, and help preserve, and cut the prescription at least in half, so that at least you have some function, even if you're still nearsighted. It's not Coke bottle thick glasses that you're so dependent upon, and it can cause glaucoma and retinal detachments and other things.
Yeah, I know for me it's really interesting kind of thinking about not living with myopia because the first thing I always do in the morning, I reach for my glasses. I just wonder how much different my life would be if I had the care I needed to slow down my myopia. Um, so I ask this question usually at the sort of end of interviews. I just think it's an important one to ask. What is one practical action every parent can take this month to support every child's long-term eye care health? Say they just saw this interview, they saw a website, or they just found out their child has myopia. What could they do?
Yeah, that's a great question. So I think we're right at back to school, right? This is August, so it's back to school month. So creating awareness about getting your child ready to go back to school, they should tell another parent. So I think the biggest thing that they could help do is tell their friends about, hey, do you know that our kids are supposed to get their eyes checked every year? And when they learn something, tell your friends, and then your friends will tell 10 more friends, and so on and so on. So we need parents to share, best practices with, their friends and family, so that the word continues to spread. And just always, August is back to school month. This should be part of your checklist to get your eyes checked before you go back to school, so that you've got the most accurate prescription and you're ready to start the school year on a positive level, and can see well to start learning.
Okay, well, that is all the questions we had. Thank you so much for your time and insight. Really appreciate it.